Hello, I'm Sarah Bellinger with the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. The FDA this week approved rival combination therapies for type 2 diabetes that pair insulin with GLP-1 receptor agonists. The market for these once-a-day injections is expected to exceed $1 billion. Approval was expected for Sanofi's Soliqua, which combines Lantus with lixisenatide, since the FDA had to act by the deadline on November 21st. But the approval for Zoltafi, the Novo Nordisk combination of its Tresiba insulin and liraglutide, comes a few weeks ahead of schedule. Studies presented at the American Diabetes Association meeting this summer show these insulin combinations can bring superior glycemic control without the weight gain and hypoglycemia that are often seen when the treatments are used separately. AJMC brought stakeholders from across cancer care to Baltimore for the 5th annual meeting of patient-centered oncology care. During the meeting, an expert panel predicted that eliminating the Affordable Care Act will not mean the end of a transition to value-based care. Keynote speaker Dr. Roy Beveridge told AJMC that means cancer patients should get more time with their caregivers.
Value care for the patient is really a great thing because I believe it's going to bring the specialists together as they look at maximizing the quality and the value for the patient. So I think it's going to bring everyone, all the caregivers together well. It's going to allow the patient to spend more time explaining what she wants, and people should probably listen more.
The American Medical Association has issued guidelines on safe and effective use of digital devices, fitness trackers, and mobile applications. The AMA finds that while these new technologies can offer value to patients, they are unregulated and rarely covered by insurance. According to the guidelines, doctors should educate themselves on privacy issues surrounding some of these technologies and even seek legal counsel so they can give good information to patients. Said Dr. Stephen Stack, the AMA's immediate past president, "It is essential that mHealth apps support care delivery that is patient-centered, promotes care coordination, and facilitates team-based communication." A study in JAMA Internal Medicine finds that dementia is declining. Rates fell from 11.6% to 8.8% from 2000 to 2012 among adults aged 65 or older, according to the U.S. Health and Retirement Survey. The study authors said higher education levels and better treatment for diabetes may help explain the declining rates. Researchers have found a strong association between insulin resistance and cognitive decline. They wrote, "Continued monitoring of trends in dementia incidence and prevalence will be important for better gauging the full future of societal impact of dementia as the number of older adults increases in the decades ahead, as well as for clarifying potential protective and risk factors for cognitive decline." Registration is open for AJMC's spring conference, Patient-Centered Diabetes Care, which brings together stakeholders from across the healthcare spectrum. Our 5th annual meeting will be April 6th to 7th, 2017 at the Teaneck Marriott at Glen Point. Topics to be discussed include paying for diabetes prevention, the challenges of lifestyle change, technology and population health, and how cardiovascular evidence affects treatment choices. For information and to register, visit ajmc.com. Novo Nordisk and the Victoza team have developed a series of videos to explain cost challenges and the role of evidence in managing diabetes. The videos are part of a broader effort to improve the type 2 diabetes management landscape. For all of us at the Managed Markets News Network, I'm Sarah Bellinger. Thanks for joining us.